Dr. Roher, we're getting a lot of comments and questions about CoolSculpting and wondering if it's possible to treat your double chin.
Okay, that's a good question. So CoolSculpting, it's a device that uses a process called cryolipolysis. Cryo means cold, lipolysis means killing fat. And so there are many different applicators on this machine. Some are huge, they could be applied to, big parts of the body, and some are tiny. So it's called the Cool Mini, and it fits right underneath the mandible, right underneath the chin. Some patients do one on each side. Some patients can only fit one in the middle. Some patients could fit three, depending on the size of the double chin. We apply that applicator with the machine and flip the machine on, and it freezes the fat for 35 minutes. Afterwards, we do a massage to help mechanically break up those fragmented fat cells. And then over the course of the next 2 months, that fat is reabsorbed and excreted through the kidneys. So I always get that question, where does it go? Results aren't instant, but it does ultimately get removed. For best results, patients should do that same treatment 2, maybe 3 times, 1 month apart. Their new slogan is it takes 2. So one treatment, 1 time is great. You will get about a 20% reduction in fat in the treated area. But when you do it 2 or 3 times, 1 month apart, you're really going to amplify those results and get, I don't know if I love the word, but snatched jawline. And the history of CoolSculpting is really cool. So it was developed by Mass Gen, the hospital associated with Harvard, and they found that kids that always put a popsicle on the same side, so I always put it outside their teeth but inside their cheek, kind of partner, they found that those kids had decreased fat on that side. So they noted that fat cells are more susceptible to cold than any other cell in the human body because they're lipid-based, not water-based like everything else. And so very smart scientists figured out a way to deliver that cold to the deeper tissue without causing frostbite on the more superficial. So obviously there's a popsicle on the inside of your mouth. The skin is intact. So they found a way to get the cold, where you don't have a mouth, so have another part of the body and get that cold to the deeper, beyond the dermal layers. So it does work. Of all the modalities to decrease fat in the submentum or underneath the chin, CoolSculpting is actually my favorite. There's also an injectable called Kybella. I think it's a little messy on personally. I love injectables. I do a lot of Botox and fillers, but Kybella, 1, it burns very badly. 2, you have to do it multiple times. So we're talking 3, 4, 5 times. So more than CoolSculpting. And 3, it's expensive because when you do the math, it works out to be more expensive than CoolSculpting. You could also there's heat modalities. So instead of using freezing cryolipolysis, it uses high temperature heat to kill the fat cells. Those I find don't work as well overall. There's machines like TrueSculpt, et cetera, that do that. And then there's, the old slightly more invasive submental or underneath the chin lipo. So just a little incision right here and then we use a little cannula and remove. It's a little more invasive, but it's predictable. I mean, it does work. It's more expensive. So of all the modalities, I like cryolipolysis, CoolSculpting. And number 2, if someone has a lot, I tend to kind of push them more in the surgical, more traditional liposuction direction. It works. It's awesome. Do it.